Hi everyone, so this week's topic is hematology, which is the study of blood and how it can impact health and disease. We spent quite a bit of time this week talking about sickle cell disease, so I'll just take a couple minutes to explain the pathology of sickle cell disease to help you understand some of the implications that it can have for patients around the world.
Sickle cell disease is a genetic disorder that affects hemoglobin, which is the part of the red blood cell responsible for binding oxygen and delivering it to the body. This alteration of the heme molecule causes the red blood cells to sickle, or to become this crescent shape rather than the healthy circular shape. The lifespan of these sickle cells is much shorter than that of a healthy red blood cell, which can cause anemia. These sickled red blood cells can also clot together in small blood vessels, depriving tissues of oxygen and resulting in sharp bouts of pain.
So you might be wondering how hematological diseases relate to global health. Hematological diseases represent a large burden of disease in terms of DALYs and QALYs, and they intersect with a number of different social determinants of health. There are a couple things about sickle cell disease that make it very interesting to study. First, as a recessive genetic disorder, those who receive two sets of the gene will develop sickle cell disease and are at a high risk for death in early life. But those who only receive one set of the genes are carriers of sickle cell trait, but do not experience symptoms. What's interesting is that carriers of the sickle cell trait experience slightly lower mortality rates from malaria, which is why sickle cell disease has persisted so long, despite being a recessive genetic disorder that causes significant mortality. Another important thing to know about sickle cell disease is that it predominantly affects visible minorities, with a very high prevalence rate in those of African descent. So that's just a bit of background information about the pathology of sickle cell disease, and that's all stuff that I'd learned before in some undergrad courses, but for me, Dr. Verhofstadt really brought in a new layer to how the disease affects populations around the world in a way that I had not previously considered. So as I mentioned, sickle cell disease affects predominantly visible minorities, especially those of African descent. Acute episodes of pain resulting from sickle cell disease can often be managed with pain medications, but sometimes the pain is too hard to manage at home and patients end up in the emergency room. There's no visible reason for these patients to be experiencing pain. That is, doctors can't simply perform a scan to identify what's causing this pain. This, coupled with the increased pervasiveness among visible minorities, can lead to problems with racism. Physicians and nurses can be quick to jump to the assumption that the patients with sickle cell disease are drug seekers. These patients often know the dose of medication or morphine that they need to ease their pain, and this is often perceived as a red flag that the patient is an addict. As mentioned in the lecture, adults with sickle cell disease experience pain on an average of 55% of days. This is just a short clip of a young girl describing her experience with seeking medications to manage her pain.
When I go to the emergency room, there's a bit of a stigma where they don't want to see, it seems like they don't want to see you straight away. And I see a doctor that's not willing to give me the typical amount of medicine that will help me get out of pain. It's emotionally frustrating, and then deal with the stress of that on top of the pain already. It just makes it worse.
Imagine how it would feel to be a person living with chronic pain. And each and every time that you sought treatment to ease that pain, you were met with resistance, prejudice, and judgment from healthcare providers.
Once a patient has experienced 100 times over negative provider attitudes, you can imagine how they're going to feel when they present. And of course, then the provider now has more attitude because the patient has attitude, and so it becomes this circle and cycle of events which really leads to poor patient outcomes, and patients don't get what they need.
The biggest message that I took home from this week was that it's important to validate the pain of patients living with sickle cell disease and not to dismiss the experience of their symptoms. This simple change in attitude for healthcare providers can have a huge impact on patients' experiences with healthcare and can drastically alter their health-seeking behaviors. Stay tuned for next week when we'll talk about the global burden of mental illness.